The number of Tommy John surgeries for baseball players is on the rise. Our digital investigative team tracked down Johnny Dirks. The UMBC pitcher said he started noticing some pain in his elbow. After meeting with a team of doctors, he decided to have Tommy John surgery at the age of 22. Seems like more kids may be getting the surgery, so we brought in Dr. Jason Stein from MedStar Union Memorial Hospital to talk about what we're seeing here. First of all, doctor, you've got a prop with this. Tell us what it is, how the surgery operates.
So this is a prop of the elbow, and what you can see here is it looks a little bit like a jigsaw puzzle. If we open it up a little bit, you can see there's multiple bones. They fit inside of each other, so it's a very stable elbow. You don't hear about many people dislocating their elbows. And then you have this capsule, which is this thick tissue, like rubber bands, that holds things together as well. The Tommy John injury is the inside part of the elbow, which is this, and when they're pitching, they stretch this out, and then it can either tear completely or stretch enough that it doesn't do its job. And this
repeated use?
Repeated use definitely is a problem, but this isn't a problem for regular life. So kids who have this injury, they go through school, they can do everything they want to do. The only thing they can't do is throw at a high velocity. So it's only a problem for that one problem.
And we see a lot of major league pitchers having it, but basically kids should not be having this done.
They really shouldn't. I mean, we should try and avoid it at all costs. And the first way to do that is to prevent it from happening in the first place. The American Academy of Orthopedic Surgeon website has some very good information for parents and coaches in order to follow pitch counts. And those pitch counts count not just for the pitching during the game, but also for practicing at home with mom and dad, practicing with the coach. And then if they're throwing a lot in other positions, because sometimes other children, they play other positions like catcher. I had one kid who came in, he was pitching, and then he would turn around and play catching, and he was continuing to throw, and he came in and injured himself.
So I guess how do parents know when they should come see a doctor like you?
Well, children shouldn't have pain when they're playing sports. It should be fun, it should be competitive, but you shouldn't be having pain. So if your child starts to complain to you about having a lot of pain in their elbow or their shoulder, especially if they're a throwing athlete, they should probably come in and be seen. For the first thing, for us to just shut them down and stop them from playing. I think that's the biggest problem, is kids just don't stop.
But is a lot of this because, exactly what you said, kids are playing sports all year round now?
Cross-training is a great thing. You know, I mean, play baseball during the baseballs, play soccer, track and field, do a lot of other, do a lot of a mix, and let the kids figure out what they really want to do, so when they get older, they can maybe pick one sport that they're going to try for a scholarship or something like that.
All right, Doctor Jason Stein, thank you so much for coming in.
Thank you.
Educating us on Tommy.